Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCrae.
You know, Tracy, getting ready for surgery can be stressful, anxiety-provoking, overwhelming. You've been there.
I
You
have.
remember. Well, to help ease your fears, it's important to educate yourself as the patient on what to expect before, during, and after the procedure. And asking your surgeon the right questions can help you prepare for an operation and improve the outcome and get you home sooner.
Here to discuss preparing for surgery and the 5 questions to ask your surgeon is Mayo Clinic colorectal surgeon Dr. Robert Cima. Welcome back to the program, Dr. Cima.
Thank you.
All right, Dr. Cima, I'm the patient, and I want to know from your standpoint, what are the most important questions that I ought to be asking?
Well, really, it comes down to questions about your surgeon and where your surgery is going to be performed. Surgery is not just a single event with a surgeon. That's the key aspect of it, but that care takes place in a system of care. So there are things you need to understand about the hospital, where it's happening, and the surgeon, and also what your role is in that place. So I usually say about my surgeon, is this the right surgeon for me? And that involves, is this person board certified in that area? The board certification is an unusual thing, is that it represents that you've done extra training, but it also represents that you've done extra training in the right field. So just because you're board certified, if you're board certified as a general surgeon, but you're going for a vascular problem, there are separate boards in vascular surgery. So you may want to ask, is this something that you do a lot of? Are you board certified in vascular surgery or colorectal surgery or cardiac surgery? Or for certain specialties in orthopedic, they have separated, not necessarily boards, but certifications. And so those are things you want to know, because it may be appropriate for your surgery to seek out someone that really does that as a specialty.
Isn't it important also to ask, is surgery the best alternative? Are there other alternatives?
Yeah, I mean, that's another big issue, is whether or not rushing into surgery is the right thing. There's a lot of evidence now for certain orthopedic issues and certain spine issues, maybe even urologic issues, that maybe surgery isn't the right option, or at least not right now for you. It might be better to do a course of physical therapy. It might be better to take a watch and wait approach for certain diseases. And so you need to have someone who gives you a balanced perspective on, is this the right thing for me at this time? And sometimes the answers can be surprising. It used to be for prostate cancer, for example, you would say, well, it's a cancer, it's got to come out. Well, as we've learned more about prostate cancer, that's becoming more and more debatable. It depends on how aggressive it is, how old you are when you present, what your other comorbidities are, what your quality of life you want. So those are issues where your surgeon has to sit down and take a patient-centered view as opposed to just a surgical view and say, what's the best thing for you right now in this circumstance for this disease?
Yep, so you ought to go over the options. Do you think it's also fair to ask the surgeon, are you the best person to do this?
Well, if you're having the operation, I think it is, because that really shows that you are looking for someone that's going to perform the best they can for you. Now, some people may feel a little uncomfortable about that, but you would, if you were looking for other things in your life, buying a home, going somewhere, buying a car, you would seek out input on whether or not that's the right person or the right product for you. I think surgery is somewhat like that. I mean, yes, there are other components that you can't select. Bedside manner, are those important? Those are issues that help you in your recovery. But I think really looking and saying, are you the right person for this specific operation? Have you done enough of these? Do you have experience in this? Are you board certified in this? Those are all important questions that do come to the very nature of the doctor-patient relationship.
Dr. Shives, have you ever had a patient ask you that?
Absolutely. And
Good.
You know what I tell them? If I thought there was somebody better than me to do this operation, I'd send you to them.
All right.
And I think that's one of the very best things about the Mayo Clinic, is that there is no reason for me to do an operation that a colleague can do better. And so I truly have never done anything that I thought somebody else could do better. If I think a colleague can do a better job of your shoulder surgery than I can, there's no reason for me not to send you to them.
Right.
All right, we have a list of 5. We have to get to the second one. We're running out of time. So what is the second thing that you should ask your surgeon?
Well, surgery is not just a simple event, like I keep on saying. It's like a marathon for some patients, depending on the procedure. And so are you in optimal shape is really what it comes down to. It just doesn't mean your heart and lungs. That means, can you tolerate the anesthetic? I'm talking about your recovery, how you're going to get up and move around. So are there things a patient can do? Losing weight, even 10 to 15 pounds, can make a significant change in a person's recovery. Sometimes surgeons are getting more and more that they want to have the patients lose weight. Certain orthopedic procedures, they try to get the patients to lose weight. Certain hernia operations, they won't operate on patients until they lose weight. The reason why is not only does it help patient recover, but it also improves the outcomes.
How about smoking?
Smoking is always a big issue, but for most elective surgeries, the data would strongly suggest that if you stop smoking even 2 weeks before your surgery, your recovery will be better. Some procedures and some specialties now are advocating that patients actually have to stop smoking before they do the procedure because the risk of bad outcomes is so high. In some of our cases, with our plastic surgery colleagues, we actually will test the patient for nicotine the morning of surgery. And if there's evidence of nicotine, we will cancel the case.
Wow.
All right, a couple of other ones that I know you recommend. One has to do with sleep.
Yeah, one of the big things is we've seen both in our population as people's weights have gone up and also a better understanding of sleep is sleep apnea. And if you have sleep apnea, you really need to let people know you do, or if you're concerned that you might, it's good to have it evaluated before surgery because there's a high risk of complications for respiratory problems in the post-op period, especially if you mix sleep apnea with an anesthetic and narcotics. And we've seen and had reports across the nation of patients who have very bad outcomes because you mix narcotics and anesthetic and sleep apnea. So if you think you might have any of the signs or symptoms of sleep apnea, get it evaluated before surgery because that could really be a problem afterwards.
And the fifth question you should ask your surgeon?
Is there something you can do actively to help get out of the hospital sooner? And I think a lot of that has to do with losing weight, physical conditioning. One of the things that's interesting is this concept of prehabilitation that we're actively looking at the Mayo Clinic, but it's also been documented elsewhere, is if you can get up and get out of a chair and walk 10 feet and turn around and come back in less than 10 seconds, that's a really good sign you're going to do well after surgery. But there's a lot of patients that can't do that. And the real question is, can we get them up and do something beforehand to condition them so that they can get up and move, get out of bed on their own, do those things before they have surgery so that they will have a faster recovery. So this concept of getting your body in shape, getting things set up for your recovery after the surgery is very important. And that's really where you need to be engaged with your physician and say, what will I need afterwards? Will I need to go to a nursing home? Will I need to have all these things set up? It makes that transition smoother, and we know if you have good care transitions, you do better in the long term.
You know, I like them all. Is surgery the best option? Number one, is this the best place for me to have the surgery? Are you the best person to do it? Are you board certified? Will it help if I lose weight? Of course, the answer is yes. Does it matter if I'm a smoker? Yes. And if I have sleep apnea, we want to know that. And is there anything you can do to shorten your hospital stay? All great questions.
Okay.
Dr. Robert Cima, General Surgeon at the Mayo Clinic. Thanks so much for being with us.
Thank you.